Good
afternoon, everyone. I am Varsha Shrivastava from Bladder Wellness team. I hope you all are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today we are here to discuss about overactive bladder. Overactive bladder is a frequent or sudden urge to pass urine. The condition can be common and distressing and may have a huge impact on the quality of life. So in this week, let's unite to raise awareness about the issues related to overactive bladder and its impact in the life of people living with it. To throw more light on the subject and discuss on what's right for the diagnosis and treatment of overactive bladder, today we have with us renowned Dr. Manoj Sharma, sir. It gives me an immense pleasure to introduce Dr. Manoj Sharma, sir, to you all. Sir is a former assistant professor at BJMC Ahmedabad and has a special expertise in reconstructive hypospadias and Uro-Oncology. He is with Tri-City Urologist at Global Healthcare Clinic, Chandigarh. Sir, it is a pleasure to have you in our show. We welcome you.
Thank you very much.
So, sir, there are many things that our viewers would like to know about overactive bladder. So first, let's start with its meaning. What is the meaning of overactive bladder?
First, we have to understand what is the function of urinary bladder. Urinary bladder, important organ in our body. Its main function is to store the urine. And whenever there is some appropriate place, when it is full, we find some appropriate place and we empty it. That is, we discharge it. So in between this period, filling and emptying, there should be no activity in the bladder. So this is known as active bladder. Its main function is to store at low pressure and completely void the urine, whatever it is in it. When this activity increases, that it contracts frequently to void, and the frequency increases or sometimes leaks the urine. That is known as overactive bladder. This is the basic thing when a patient is having overactive bladder.
Okay. So, sir, what could be the different reasons behind it? Why does it happen?
There are so many reasons behind it, behind the overactive bladder. So, first and foremost reason is infection. Infection causes overactivity of bladder because it irritates the bladder mucosa. Second thing is old age. In postmenopausal female, the activity of bladder increases because of estrogen deficiency. Third is obstruction due to prostate. This is also causes overactivity bladder. Sometimes malignancy. This causes overactive bladder. So there are so many causes. Most common cause is infection and neurological causes. So these are various causes. These irritate the bladder and bladder contract more frequently, causing various symptoms. These symptoms bother patients so much that it makes the quality of life very low. And patient has to void frequently. That patient cannot travel because of frequently they can't use public transport. They have to stop their vehicle on the way. Wherever they go, they look for the washroom. They cannot go to religious places. At night time, they have to wake up frequently and the sleep is not very much disturbed. So these are the various things which bother the patient a lot. Yes. So making the bladder quality of life very low.
Yes, sir. So, sir, what could be the early signs or symptoms through which the patient can understand that, yes, he might be suffering from overactive bladder?
Patient is having quite frequently, they have to go to washroom. They have to wake up at night so many times, like 3-4 times at night. So the sleep is not complete. Then sometimes the urge is so much that patient leaks. We call it urge incontinence. Every time every hour patient has to go to washroom. Sometimes they cannot control, they leak. These are the various symptoms of overactive bladder.
Okay. Sir, how many times using the restroom is considered as normal?
You know, the capacity, normal capacity of bladder is normally 350 ml to 500 ml.
Okay.
To fill this, it takes approximately 2 to 3 hours when we are adequately hydrated. So 3 to 4 hours is the frequency, every 3 to 4 hours. At night, once a patient sleeps, maximum 1 time or 2 time is the normal night frequency. So patient should not wake up, any person should not wake up once or twice, more than once or twice. That means the frequency has increased. So less than 4 hours is a increased frequency.
Okay. So any of these symptoms, this is for all our viewers. If you are finding any such symptoms, then it can be a sign of overactive bladder. Then it is the time for you to consult a urologist and find the real solution for your problem.
Yes.
So, sir, who are basically more prone to this particular problem? Does it happen to elderly patients, or even the youngsters can get affected by it?
Youngster can get affected by it because some people, they have more frequent infection of urine. Some youngster, they have some neurological problems like problem in spine. Sometimes there is post trauma, like accident, post accident, any problem in spine happens. Sometimes neurological cause in youngsters. But old age people, they definitely have some cause like repeated infection, postmenopausal estrogen deficiency, prostate enlargement, bladder stone, urinary bladder stones, infection, repeated infection in urinary bladder, and malignancy. These are the reason for the overactive.
So yes, even the youngsters can get
Youngster
affected.
can have, even the kids can have when they have some congenital anomaly. They have neurogenic bladder, so they have overactive bladder.
Okay. So,
Yeah.
sir, when the patient is figuring all these symptoms, so what is the step they can take? Can they really cure it in their home, or they need to take a treatment?
First of all, we need to go to the cause. What is the cause of this overactive bladder? So we have to investigate the patient. What is the reason behind it? Whether it is an obstructive problem, whether it is overactive problem. What is the problem for this overactivity? If it is infection, we treat infection. So treating infection will calm down the bladder and bladder will be normal. Sometimes there is a foreign body inside like bladder stone. It irritates the bladder. Overactivity increases. So this is the reason for the. Sometimes there is obstruction in youngster. It is narrowing of urethra. We call it stricture urethra. So to overcome it, bladder become more powerful and active. So it becomes overactive bladder. Sometimes because of obstruction, the patient cannot void completely. So some urine remains inside the bladder. It is the reason for overactive bladder. Sometimes it is the pelvic floor muscle deficiency. So control is weak. So anytime mild activity will lead to leakage of urine. This is also known as overactive bladder. So we have to find out the cause for it. And sometimes the neurological cause, bladder is overactive because of neurological reason. So we have to take the help of some medicine to treat it. We can treat it surgically. We can treat with medication. Like infection, we can treat with medication. Like neurological cause, we can treat with medication. Any other treatable cause like obstruction, stones, and malignancy, surgically we remove them and treat this.
Okay. So once the patient goes to the hospital, so what are the different tests which are conducted so he can get the surety that yes, he is suffering from overactive bladder?
First and foremost test is we test the urine, and the patient whether there is infection or not. Then we physically examine the patient, whether some neurological deficiency is there or not.
Yes.
Third test most commonly done is ultrasound to look inside the bladder. Is there any change in the bladder? Whether there is something, some foreign bodies in there, we rule out malignancy in the bladder. So these kind of various investigations are done. Once we find out that these investigations are normal, so we do flow test, whether the flow of urine is normal, anything left after voiding, post-void residual urine, how much is it? If it is much more, then likewise we treat it. Finally, we do urodynamic test to see the activity. Urodynamic test is a very important test to see the functioning of bladder, whether it is functioning normally. So we slowly fill the bladder and measure the pressure inside the bladder. How much pressure is there? So we see the function of bladder. Normal function is low pressure storage. So we very slowly fill the bladder, and we simultaneously measure the pressure. And then when the bladder is full, patient says that now it is of full capacity, then we ask the patient to void. So we see the graph. If this graph is normal, then patient's bladder is normal. So any overactivity will be depicted in graph. And accordingly, we see how much overactivity is there, and likewise we treat it with medication.
Okay. So, sir, once these tests are conducted, after how many days the patient can expect to get the reports?
Immediately after that, we just see the graph and report it. It is that we are sitting there and looking at the graph and this test, and we immediately report it. Tell the patient that how much overactivity is there.
Okay. So this is the good part actually, that the patient won't have to wait for long. There and then they'll get the report.
These are just initial tests which are like urine test or ultrasound. We have to wait for that. Otherwise, other tests are.
Okay.
Yeah.
So, sir, once the patient has got the report and he gets to know that he is suffering from overactive bladder, so what is the initial treatment that has been given to the patient?
We have a lot of drug like tolterodine, like solifenacin, like mirabegron. So many bladder relaxant we have. We give the bladder relaxant, but we have to. These are for the symptoms. We just have to treat the cause also. If we find the cause like stone, infection, obstruction, prostate, or estrogen deficiency, we treat that simultaneously with bladder relaxant also. We have very good drugs nowadays which relieve the patient of severe symptoms and make the quality of life good.
Okay.
So this problem of overactive bladder is treatable. Sometimes the patient adjust like that, they stop going to the social places, they stop traveling in the public transport system, and people should not do that. People should consult the specialist immediately and get themselves treated. Find out the cause, get the cause treated, and if the cause is not there, some neurological cause is there, we have very good drugs to treat them. This is a treatable problem.
Yes.
So patient, they should consult a specialist for that.
So yes, there is nothing to worry. This problem is completely treatable only if you'll come at the right time and take the proper treatment.
Yes.
That is very important.
Yes.
Okay.
Sometimes we delay the treatment and there are permanent changes in the urinary bladder. We should not let it happen. We should go to the specialist early and get ourselves treated for this. Investigated and treated.
Yes, sir. Okay. So, sir, whenever the medicines are given, so there are some or the other side effects related with the medication. Yeah. So, sir, what are the side effects of the medication that has been given for overactive bladder?
Very few side effects, like sometimes dry mouth is there. That's all. Because we have choice of different drugs, so there are few drugs which causes dry mouth, there are few drugs which causes less dry mouth. There are some drugs which are having minimal side effects. So that way, one drug is more effective, other is not. So we have battery of drug, which we have lot of choices. We have lot of permutation combinations, and normally these side effects are overcome.
So
These are
even
very
these
mild,
yes.
not very bothersome.
Yes.
The overactivity is more bothersome.
Yes, that's there. So even if the patient, you are suffering from any of the side effect also, then there is nothing to worry because
These
they are.
side effect can be managed.
Yes.
And these are very few, not much.
Okay. So, sir, how long does the treatment go for overactive bladder?
It depends upon the cause of the overactive bladder. Like once the infection is treated, patient is cured. Stone is removed, patient is cured. Long time treatment is when there are permanent changes, when patient delay the treatment. Once this cause is removed and there are no permanent changes, patient is cured. Long-term treatment is only for neurological and when the problem is of long-term, long duration. Treatment is also.
Okay. So in most of the cases, it is seen that whenever the patient finds any kind of changes, he feels that now he is completely cured from the problem and he stops taking the medication. Yeah. So is it advisable to completely stop the intake of medication, or he should stop it slowly?
We normally stop these medicines slowly. Sudden stoppage of medicine, sometimes the symptoms reappears. So stopping the medicine, we should always consult a specialist. How should we stop? Whether we taper down it or sometimes we substitute with milder and then we stop it. So it should be always with consultation of specialist. Patient should never stop the medicine of itself. Sometimes patients stop the medicine because of side effects, but they should consult, get the medicine changed and get another medicine with less side effect. So patient should not stop the medicine by its own. They should always consult a specialist before stopping.
Yes. A very, very important point we got to know over here, that whenever you are taking any kind of medication for treating overactive bladder, you should not stop it there and then. Please consult a urologist, and whatsoever has been prescribed, please follow that. And then you can treat it. Yes, of course. And sir, if the treatment is not that much effective, even after taking medication, what is the next step?
Well, then we again investigate to find out the cause, because whenever there is in a urodynamic study, patient shows that there is a overactive bladder in urodynamic study, we always find out, look for the cause. There must be some cause. Sometimes diabetic patient, they have a neurological problem. Sometimes there is some spinal disorder. Sometimes old age people, they have some spine problem. Sometimes there is malignancy elsewhere pressing the nerve. So we find out the cause. And once the treatment is not effective, we have to investigate further and find out the reason why the treatment is not working in that patient. So there is always, once the treatment is not working, there must be some cause. We find out the cause, another cause is.
And sir, what are the surgical methods that are adopted to treat overactive bladder?
When the obstruction, रुकावट है अगर किसी के यूरिन फ्लो में, तो we remove that obstruction, we repair them. Sometimes prostate, sometimes old age female, they have estrogen deficiency, they have obstruction at the level of urethra or meatus. So we remove them, that, and overactivity is overcome. We remove foreign body like stones, we remove any growth or malignancy, we treat them, and then with the drug we treat. And
so sir, once the operation is conducted, after how many days the patient can go to his home and perform the daily routine?
Nowadays the surgery become very easy, endoscopic surgeries are there. Sometimes we admit a patient in the morning and discharge in the evening. Sometimes overnight stay, nowadays it is never more than 2 night stay even for a major operation. So, endoscopic operations we have, laparoscopic operation we have. Surgery is become now less invasive and very easy for the patient.
So another good point.
Maximum 48-hour admission.
Okay. So after 48 hours, the patient is discharged in most of the cases.
Discharge and rest recovery is it approximately take a week or more.
So, sir, till then, for a week or two, what are the things that the patient need to keep in his mind so he can take good care of himself?
Patient need to take care that the problem which are recurrent, there are some preventive advices from the expert. There are some problems during recovery, they have to take care, and they have to take medicine according to specialist advice. They should not stop the medication. Most important is the preventive aspect of it, so that the overactivity doesn't take place, like how to avoid recurrent infection, how to avoid recurrent stones. If there is a malignancy, then regular follow-up is required so that it should not recur. What are the different investigation they have to undergo for to find out the recurrence? These are the various things, and they have to take medication as prescribed regularly so that the recurrence should not take place. These are the things patient should be advised after surgery.
Definitely. And sir, once this problem is treated via surgery, so are the chances there for this problem to reoccur?
There are chances of recurrence. This is because some problems are recurrent problems. So with the help of specialists, they should continue their treatment and avoid the recurrence of them. Recurrence can be avoided.
Yes. Yes, sir. Another point that we can avoid the reoccurrence of it by taking proper care of ourselves. That is important.
Yes.
Okay. So, sir, let's take some viewers' question that we have got in our live session. So, sir, first question is from Ajit Singh, and he's asking, sir, are there any lifestyle modification or the steps to take in order to manage overactive bladder?
Yeah, Ajit, we can take lifestyle modification that we have to sometime nowadays, there are a lot of lifestyle problem. People take junk food, lot of salt, soft drinks, aerated drinks. Yes. These are a little bit of acidic things. So we should take a plenty of water. The person who is having a night frequency, they have to repeatedly wake up at night, they should reduce the water during the evening. In the day, they should take a lot of water. And because the frequency can be managed in the day, night frequency is lot of disturbing, so these kind of lifestyle changes. Pelvic floor exercises, it reduces quite a lot the overactivity of bladder. So we should do pelvic floor exercises also. These are the few lifestyle changes we need to prevent recurrent infections. There are various methods of prevention of infection. You can consult the expert. That can be few changes in the lifestyle.
Okay. And so next question is from Pratham Dhakar. He's asking, sir, diabetic population is also affected from overactive bladder, and how can we overcome?
The diabetes is the disease which affects almost each organ. It affects our nerves also. So we call it diabetic cystopathy. Neuropathy and cystopathy. First, it affects nerves and then it affects the urinary bladder. Sometimes there are various effects of diabetes, like it can decrease the activity of bladder, it can increase also. So part of overactivity, the cause of overactivity is diabetes also. So we should control the diabetes, take proper medication. We should do exercise. A diabetic patient should always do exercises, that is pelvic floor exercises. And third thing is that the long-term diabetic patient should always consult their doctor to prevent these cystopathy or neuropathies. So once you are in well control of diabetes, these things happen rarely. So a diabetic patient should take care of all these things. They should always consult a urologist as well as endocrinologist for this.
Okay. So yes, diabetic patient need to be extra careful as they can suffer from overactive bladder. Okay. So next question is from Asha Yadav, and she's asking, sir, क्या COVID रोगी भी overactive bladder के प्रति संवेदनशील है या उसको भी हो सकता है क्या overactive bladder?
COVID is a very new problem, and we don't know whether as of now there is no association between bladder and COVID. So there are certain things that in COVID patients who are affected actively, they are given steroid, so their diabetes become uncontrolled. Patient on steroid gets more frequent infections, bacterial infections. So this can be an association between a COVID patient and a overactive bladder patient.
Okay.
So patient having overactive bladder and developing COVID, these symptoms can increase. So,
yes, that's there.
The drugs are required to prevent this.
Any which way, COVID patient need to be extra careful in every
patient
aspect.
Who are having overactive bladder and developing COVID should be extra careful.
Yes, sir. And sir, mostly it is seen in pregnant women also that they have the sudden urge to pee. So what is this problem, and can they take medicine when they are going through pregnancy?
There is no such data like these drugs are quite safe in pregnancy, but the reason for this is the baby in the uterus. That baby slowly increase in size. जैसे बेबी का साइज बढ़ता है या यूट्रस का साइज बढ़ता है, ये ब्लैडर पे प्रेस करता है. So this is an external cause. Once this after delivery it becomes smaller size, the uterus become normal size and pressure is released, and then pregnant women, they quite frequently go to the washroom.
Yes.
This is the reason, because the uterus and baby, they press on the bladder. They are closely associated. Uterus and the urinary bladder are closely associated. So this is the reason for that.
Yes.
So they don't have a permanent overactive bladder.
Okay.
Yes, sometime after delivery, when there is a difficult delivery, there is some damage to the pelvic organ or pelvic nerve. Sometimes they develop post-delivery overactive.
Okay.
That require drug treatment. Otherwise, no drug treatment is required for the pregnant.
Okay. So for all the pregnant ladies, there is nothing to worry. It's just for the time being. And after delivery, everything will be normal. And if it is not, then you can consult a urologist and take
drugs cannot control the external pressure.
Yes.
Yes. So I think they don't require any drug treatment.
Okay. So sir, let's take next question from our viewer, and this is from Aarti Sharma. Sir, she's asking, sir, क्या smoking और drinking से भी bladder पर effect होता है?
Drinking का effect होता है bladder पे, और smoking का भी होता है definitely. Smoke is a carcinogen. The most common cause of urinary bladder cancer is smoking. So smoking directly affects. Second thing is drinking. Drinking alcohol produces a lot of urine. The alcohol byproduct, they have to be flushed out of the body because they are harmful. So kidney become overactive and produce a lot of urine. So the person who drinks, they have to go to washroom because they produce a lot of urine.
Okay.
So this affects both of them.
So any which way, smoking and drinking is always injurious to health. So the best advice is
health, and as well as the specific effect on the urinary system. These two are specific.
Yes. So in this case, smoking and drinking should be avoided. So the bladder itself is healthy.
Smoking is the
and
most common cause of bladder cancer.
So another important point that smoking is the main cause behind this bladder cancer. So if you want to be healthy, avoid smoking.
If we see the bladder cancer patient, most of them are smokers.
So that should be avoided.
Yeah.
Okay. So, sir, next question is from Shivani Mishra. And she is asking, sir, if someone is leaking urine during laughing or sneezing, then does it belong to overactive bladder?
That may not belong to overactive, because during sneezing and coughing, if somebody leaks, that we call it stress incontinence. When the pressure inside bladder increases, that means the control is weak. So we call it stress incontinence. But sometimes overactive bladder with a normal control, they leak because there is too much pressure inside bladder. So it can be we can associate, but not completely. There are different reasons. Part of the patient, they have a stress incontinence, and part of patient, we call it urge incontinence. When the bladder contracts and we cannot control, we call it urge incontinence. So urge incontinence, sometimes these are combined. Patient have both urge as well as stress. So we treat the urge incontinence, the symptom reduces.
Okay.
Two are different. We find out the cause of it, whether it is a urge incontinence or a stress incontinence, and treatments are also different. So stress incontinence we treat surgically, urge incontinence with medication.
Okay. So this is urge incontinence and even stress incontinence. We got to know over here in our live session how we can treat it. So another important valid point over here.
The important thing is symptoms should go. The present feature is the leaking. Presenting feature is the leaking. So leaking, we should stop whether it is stress or urge. To differentiate and to get treatment, you should always consult specialist.
Yes, definitely. So whenever you want to treat the problem, please consult the specialist and please follow all the steps which have been suggested. Yes. Okay. Sir, next question is from Jay, and he's asking, sir, is overactive bladder fully treatable in old patient?
With the help of surgery in old patient, we find out the cause. If it is surgically treatable, and we take help of drugs also, we combine the treatment sometimes. Old people need combination of treatment. So it can be treatable.
Okay. So mostly it is seen in old patient that they are already very weak and many a times they don't even respond to the medication. So in that case, can we perform surgery on older patient or surgery is to be avoided?
Well, we avoid surgery in old patient, but when there is a definitive cause is there, we have to remove to improve their quality of life. So whenever surgery is must, we do surgery, but we take help of medicine first. Non-surgical procedure we take first. Things we take first. We try medicine and something. If their quality of life is not improved, we do perform surgery.
Okay. Yeah. So older patient need to be really, really careful, and the treatment is also done very carefully in the older patients. Okay.
It is very less in younger patient. Most bothering problem of overactive bladder is mostly in old patient.
Okay. And sir, some cases are there in which the kids, they leak their bed when they wake up. So that is also a sign of overactive bladder, or that is something else?
Sometimes this is we call nocturnal enuresis, because the kid till the age of 5 they learn this toilet training. We call it toilet training. At the age of 5 or after the age of some kids, this training is delayed. But after the age of 5, they should stop leaking in the bed at night. We find out the cause, and there is whenever there is a cause of it, we treat the cause, and otherwise we take help of drug sometime to make them learn this habit of dry.
Okay. And so there is this term, bladder training and bladder diary. So
Right.
what are these and how are they helpful?
These, whenever we investigate the patient, we tell them to make a bladder diary also, because it roughly gives us idea of how much the capacity of the bladder, what is the frequency every hourly or 2 hourly the person is going, at how many times the patient wakes up at night, what volume of fluid he's taking, intake of water or fluids, and what is the output. So this gives a rough idea whether what is the culprit, whether some patient they take a lot of water, every compulsive water drinking, every half an hour they drink water and they get more frequently. So we reduce the water. Sometimes they go more frequently and bladder capacity is less, that make it over. The presenting is overactivity. So we measure the capacity of bladder, and when the capacity is less, then and there are some reason for it, we increase the capacity of bladder and patient is treated. So for the treatment and diagnosis, we take this bladder diary. Bladder training is whenever the capacity is okay. It is seen on the urodynamic study. What is the problem? So the bladder training we give is to learn to hold the urine. Sometimes people, they are a little urge, they go to washroom, a little urge, they can control it. So we train them, and the problem of overactivity is treated.
Okay, so sir, in the end, sir, what is the suggestion to all the viewers and especially the patient who are suffering from overactive bladder?
Overactive bladder is a very common problem. A lot of people, they are suffering from it and they don't consult the doctor till it bothers them a lot. Their daily activity is affected, and when they come, there are some permanent changes in the bladder. So one should always consult a specialist and find out the cause and get this cause treated and get rid of this problem. Sometimes it affects their life so much, they need some drug treatment and physiotherapy, etc. So they should consult, go to a specialist and get themselves a proper advice, get themselves treated, and should overcome this problem. Because these are a lot of drugs, those with minimal side effects are available, and they can take those drugs also with the help of their treating doctor. So this is a treatable. One should not avoid going to a doctor and get them. Sometimes the problem is like treatable stage of cancer. So you go to a doctor, find out the cause. I am going quite frequently for the urination, and very simple investigations are there, and you get rid of this disease. Cancer, once in advanced stage, is very tough to treat. So these are the various aspects. Always a overactive bladder patient should consult a doctor, find out the cause, and get themselves treated. This is the take-home message.
Definitely. So, sir, we got to know many important points over here in our live session regarding overactive bladder. So this session was indeed very much informative and very useful for all the viewers, and they got to know many things about overactive bladder. I hope all the viewers will keep all the important points in their mind. So thank you so much, sir, once again for such a fruitful session. We really hope to have many such sessions from you, sir. Thank you so much. And thank you to all our viewers for being so patient. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of Bladder Wellness. You can also follow us on YouTube, Twitter, and Instagram by the same name, that is Bladder Wellness. This is your host, Varsha Shrivastava, signing off. Take care, everyone. And thank you so much, sir, once again.
Thank you.